care outcomes for our various minority populations. Our current non-system is expensive, frequently ineffective, and the distribution of care resources is often dangerously and shamefully inequitable. This is clearly the wrong place to be. I am definitely not the only person who believes that to be true. Far from it. Just about everyone who thinks seriously about American health care today is coming to that same conclusion. It's obviously time for a change, and multiple change agents in our society are increasingly ready to move to a better approach. In my job as CEO of a fairly large healthcare organization, I've talked to the heads of major unions, senior political leaders, senior community leaders, and the heads of more than a dozen major U.S. corporations. Over the past couple of years, I've talked to industry consultants, to the human resource leaders for a lot of companies, and to senior executives from quite a few leading healthcare institutions. I've also talked to friends, neighbors, consumers, patients, and various people involved in community activities. Without exception, I hear a call for change. Now. People have lost patience. The time for change truly is upon us. The problem is, change to what? There isn't a consensus about what we should change to. Everyone knows the problems. No one knows the solution. So we have an incredible tsunami for change building up massive levels of societal energy with nowhere for that powerful but currently undirected and unfocused wave to go. That's one purpose of this book, to point in one possible direction toward a total package of healthcare reform that might actually solve major portions of the quality problem, mitigate and significantly improve the cost problem, resolve much of the societal inequity that results from having so many people uninsured, and help solve that full set of economic problems in a way that is uniquely American. Moving to universal coverage has to be part of that solution. Every country takes its own path to universal coverage. I've looked at the universal coverage plans of 20 other countries and talked directly to the health ministers of half a dozen to learn how other countries have dealt with those same issues. What I learned was that even though every other industrialized country has achieved universal coverage, they have each taken their own unique path to get there. The Canadian system, the British system, and German systems are not identical. The approach each country has chosen to get to universal coverage, and much lower overall health care costs than our costs in this country, all fit the specific local logistics and the unique economic and cultural needs, values, belief systems, and characteristics of each country. I have learned that each and every country has designed its own unique version of universal coverage based on the local economic and political characteristics unique and relevant to each country. I mention that because I believe we need to do the same thing here, evolve to an American system that achieves universal coverage for this country using those specific characteristics of care delivery and financing that are most valued by the American public and the American electorate. Simply cloning and transplanting Canadian health care is not a viable option. Doing significantly better than Canada is. Stealing a few good ideas from Canada makes a ton of sense, but in the end, if we truly want to succeed, we need our own approach to getting coverage for everyone in America. A major portion of this book is written to offer a series of facts, data points, observations, and functionally practical suggestions about how we can create a more patient-centered American healthcare marketplace that offers patients truly well-informed choices, affordable coverage, and an array of fully accountable healthcare providers competing for patients in the context of value, performance, and cost. We need an American approach that builds effectively and directly on the principles of continuous process improvement to enhance American care delivery while making care more accessible and affordable. I don't approach these problems from an academic perspective. From a purely functional point of view, I've been directly involved in or worked closely with pretty close to every level and category of healthcare financing and delivery over the past 3 decades. Over those years, I've worked in health insurance, health plan management, care system management, and direct care delivery operations. In my current job, I'm the chair and CEO of one of the larger hospital systems in America and the 3rd largest health plan in the country. Over the past 3 decades, I've worked with the private market, Medicare, Medicaid, and various other governmental programs. I've also had some experience in other countries, starting a health plan in Jamaica quite a few years ago and helping start 20 small health plans in Africa only a few years ago. I'm currently board president for the International Federation of Health Plans, an association of 75 independent operational health plans from 25 countries, ranging from